Cleansing the colon will greatly improve the metabolism and eliminate a major cause for gaining weight. Now let's talk about inflammatory bowel disease, or IBD. The term inflammatory bowel disease refers to a large group of disorders that affect the gastrointestinal system, and as the name implies, causes inflammation in the digestive system. Inflammation is a process that occurs when the body's immune system begins to fight off viruses, bacteria, or fungus, creating some chemicals which may irritate the body's own tissues, causing heat, redness, swelling, and loss of function. Now, these changes are all characteristic of inflamed tissue. In ulcerative colitis, inflammation occurs in the lining of the large intestine and the rectum. In rare cases, it may extend into the small intestine. But in most cases, however, the small intestine remains normal. There is strong evidence suggesting that dietary factors are the most probable cause for this disease. Ulcerative colitis and Crohn's disease are two common forms of IBD. Ulcerative colitis occurs only in the lining of the intestine, while the damage caused by Crohn's disease can extend to all layers of the intestinal wall. The inflammation associated with ulcerative colitis can eventually cause portions of the intestinal lining to peel off, exposing open pits or ulcerations which can easily become infected. Ulcerative colitis occurs in all age groups and affects men and women equally, although the most common age of diagnosis is between 15 and 35 years of age. Another serious condition which develops as a result of not having enough fiber in your diet is diverticulosis. Diverticulosis is a condition where pockets or pouches form in the large intestine. The large intestine is a long tube-like structure that stores and eliminates waste material. During normal lower intestinal function, the waste material is slowly pushed along the large intestine to the rectum by the muscular bands in the colon. As a person ages, this continuous pressure can cause a bulging pocket of tissue or a sac called a diverticulum that pushes out from the colon wall. More than one sac is called diverticula. The condition of having diverticula in the large intestine is called diverticulosis. When a diverticulum ruptures or becomes infected, this condition is called diverticulitis. Diverticulitis develops when a mass of hardened waste matter forms in the pouch and reduces the blood supply to the thin walls of the pouch, making them susceptible to infection by the bacteria of the colon. It's estimated that 30% of all people over the age of 45 have diverticulosis. At the age of 60, 50% of all people will develop this condition. And by the age of 85, 65% of all people will have diverticulosis. Researchers believe that diverticulosis may be age-related, but most importantly, it's caused by a lack of fiber in the diet. A diet low in fiber can lead to small, hard stools that are difficult to pass and require more pressure to push them through the large intestine. Over time, these vigorous contractions in the large intestine push the inner intestinal lining outward, causing diverticula. Now, the last condition we'll discuss is constipation. Constipation is an acute or chronic condition in which bowel movements occur less often than usual, or consist of hard, dry stools that are painful or difficult to pass. However, constipation is a relative term, with normal patterns of bowel movements varying widely from person to person. Now, the colon absorbs water while forming waste products from digested food. Muscle contractions in the colon are called peristalsis. This process of peristalsis pushes the stool toward the rectum. By the time the stool reaches the rectum, it's solid because most of the water has been absorbed. However, hard, dry stools and constipation occur when too much water is absorbed by the colon from the stool, which can result from the muscles of the colon contracting too slowly. Constipation is also referred to as irregularity of bowels or lack of regular bowel movements. Constipation usually results from not getting enough exercise, not drinking enough fluids, especially water, or delays in going to the bathroom when there's an urge, or from a diet that does not include an adequate amount of fiber-rich foods such as beans, bran cereals, fruits, raw vegetables, rice, and whole grain breads. Eating too many dairy products such as milk, cheese, yogurt, and ice cream may also result in harder stools. A person with normal bowel movements should have between 2 or 3 bowel movements per day when eating 2 or 3 meals per day. These bowel movements should be effortless, odorless, with a set shape, and should leave you with a sense of satisfaction and cleanliness when you finish. For illustrative purposes, let's take a look at a normal colon. Note the ascending colon, transverse colon, descending colon, sigmoid colon, and the rectum. As you can see, toxic waste accumulates, causing poisons to be absorbed inside the body. This is what happens to our body when we don't evacuate regularly. We are basically carrying poison inside our bodies. The immediate effect is that not only are we carrying these toxins inside our bodies, but we're also physically carrying around more weight, leading to obesity. The symptoms of constipation include general discomfort, and if they persist, can result in medical consequences. The various medical conditions we've seen here could have been greatly alleviated or perhaps even avoided simply by having an adequate intake of dietary fiber. Now that we've seen the various medical conditions which can develop as a result of poor digestive health, I'd like to share with you some things that you can do to improve your health. Include in your diet foods rich in fiber. As we previously saw, fiber is important for healthy bowel movement and can be found in fresh fruits, raw vegetables, whole grain breads and cereals, nuts, and beans. Include in your diet fermented dairy products. Probiotics, or friendly bacteria that's found in dairy products like yogurt and cottage cheese, can improve intestinal function and overall digestive health. Drink plenty of water. Water is needed to alleviate and prevent constipation and ease digestion of foods through the digestive tract. Include fish 3 to 5 times per week. You see, fish contain omega-3 fatty acids that can improve digestive abnormalities by stabilizing cell walls, reducing inflammation, and restoring balance. Exercise regularly. Most everyone knows that exercise offers overall health benefits, but most people don't know that it's also very beneficial for your digestive tract. In a nutshell, adopt a sensible, healthy diet with plenty of natural, unprocessed foods. If you're not sure that you're receiving sufficient fiber in your diet, consider taking a fiber supplement. This is Dr. Luigi Groton wishing you all the best of health.